Hello, everyone. My name is Heidi Christensen, and I'm with the Center for Faith and Opportunity Initiatives at the U.S. Department of Health and Human Services. We are so very glad that you have joined us today for this fourth in a series of webinars featuring community leaders talking about the innovative and promising practices they are implementing across the country in response to the opioid crisis and the need to support those struggling with substance use disorders. Today's presentations with our very special guests who are calling in from all over the country, and we've had a lot of weather issues, so that's why we got started just a little late this morning, but they include the nation's Surgeon General, Vice Admiral Jerome Adams, Chuck Collins, President and CEO of the YMCA of San Francisco, and Pastor Travis Lowe of the Crossroads Church in Bluefield, West Virginia. And they will focus on the value of employment and supporting employees in recovery, workforce development, especially among our young people, and how faith communities are joining with local businesses to inspire entrepreneurship, hope, and healing in their community. So we have an exciting and informative program today, and I'll introduce our speakers a little bit in a moment, but first a few housekeeping issues before we begin. This is an educational webinar, so it is off the record and not intended for press purposes. If you are a member of the press, we will be happy to connect you to the press office here at HHS after the program. And while we do have a full program today, we welcome your questions and comments throughout the webinar. And you can see in the corner of the right-hand corner of your screen a box for questions, and you can type in your questions there. We hope to share as many as possible with our presenters during the brief Q&A at the end of the program. Also, if you are having difficulty with your audio, you may find it helpful to call into the number on your screen rather than listen through your computer. We have just found that sometimes that just works better for sound quality. And as a final note, we will be sending a link to a recording of today's webinar in a follow-up email to everyone who has registered, along with the links to the resources and information that will be highlighted by our speakers today. So look for that in the next day or two. With 116 Americans dying every day from an opioid overdose, we are in the midst of a critically acute crisis. A crisis many of our community stakeholders are quick to tell us is exacerbated by the other drug and substance misuse already rampant in their communities. And while folks across the country are in full stride responding to this emergency, as well as supporting the needs associated with a chronic condition and long-term recovery, many are pausing to look deeply into the issue and see that one of the contributing factors fueling this epic misuse of substance is a crisis of hope and a lack of opportunity. We've heard drug overdose fatalities referred to as deaths of despair, and they are impacting our families and communities and taking a toll on our economy. Employment can be critically important to the long-term success and the stability of recovery efforts. Empowering individuals with new skills and transitional support while they are learning to manage their addiction may help to restore them to self-sufficiency and to make plans for a meaningful life that is no longer needs drugs to sustain it. The good news is that every day we learn about faith and community-based organizations getting people back to work, teaching life skills, soft skills, job readiness training, on-the-job training, internships, job placement services, connecting folks to certification programs for the culinary arts, welding, pest control, housekeeping, and even peer recovery coaching. So today we'll hear more about these smart and hopeful practices. And to help place these efforts in a national context, I am delighted to introduce the nation's 20th Surgeon General of the United States, Vice Admiral Jerome Adams. Among the priorities he has outlined for his office is addressing the public health crisis of addiction and demonstrating the connection between health and economic prosperity. Now, before he became America's chief doctor, the Surgeon General served as the health commissioner for the state of Indiana, where he was deeply engaged in the state's fight against the opioid epidemic. He's also served as a staff anesthesiologist and taught anesthesia at the Indiana University School of Medicine. But our team is especially excited that Dr. Adams' motto is better health through better partnerships, and that as Surgeon General, he is committed to forging new partnerships with non-traditional partners, including faith and community organizations, business, and law enforcement. Dr. Adams, we are so very grateful that you are with us today, and we look forward to your remarks.
Well, thank you, Heidi, for that kind introduction and for your incredible leadership. Thank you to everyone for joining us today. I just really appreciate the opportunity to address you all on a topic that is near and dear to my heart, that being the intersection between communities and the economic prosperity of those communities and health. I've been told that there are over 1,400 individuals who signed up for this call. And again, I think that's a testament to how committed folks are. And my job, my role, my success as Surgeon General will be determined by how well I am able to put each and every one of you in a position to lift up the health in your communities. As Heidi mentioned, joining me today are Charles Collins with the YMCA of San Francisco. Really excited to hear his remarks because they're where the rubber meets the road in a lot of our communities. And I just am so grateful for the work of the Ys throughout the country. And Pastor Travis Lowe of Crossroads Church in West Virginia. And Pastor Lowe may mention this, but I think we all should think about and say a prayer for the folks in Milwaukee. I know many of you all have heard about the church there that burned down last night. At least thus far, I've heard that there haven't been any injuries, but still just a tragic fire there for a historic church. Strengthening relationships within our communities is key to improving health, and I commend you all again for the idea of better health through better partnerships and embracing that because it is my motto. I want to talk to you a little bit about my vision for my time as Surgeon General. And I want you all to know that I believe in my heart and in my soul that every American in every community deserves to live a long and healthy life. Unfortunately, we are falling short of that goal. Life expectancy in our country has declined for the second year in a row. I represent the first generation of parents in over 50 years who, as of right now, can't look their children in the eye and say, "You're going to outlive me." I don't want that to be the reality for my children or for your children or for the children in the communities that you serve. We need to recognize the important role wellness plays in all aspects of our society and recognize that wellness and health are intimately related to, but also not the same thing as health care. My vision for a healthier America can only be achieved if we reframe the way we discuss health in this country so that it fits in with American priorities. And that's why I've personally chosen not to focus on a particular disease during my time as Surgeon General, but to focus on health in the economy, health and national security, and then the opioid epidemic, as Heidi mentioned earlier. Now, it may seem odd for a Surgeon General to focus on jobs in the economy, to focus on safety and national security, but Gallup polls tell us consistently that voters rank jobs in the economy as their number one priority and safety and security as their number two priority in terms of deciding how they vote. Health rarely ranks in the top five, and if we're being honest, typically doesn't even rank in the top 10 of issues that people vote on in the ballot box. Now, they'll vote on health care, but I would argue that that's still a function of jobs in the economy because people care when they can't contribute to their 401k, can't go on vacation, can't pay the mortgage, can't keep the lights on because they're going bankrupt trying to pay for their medical bills. It's still a function of health care and not health, and it's still a function of jobs in the economy and the economic impact and not so much a focus on wellness that brings them to that place. We also know that 7 out of 10 of our young adults are not eligible for military service because they can't pass the physical, they can't meet the educational requirements, or they have a criminal background record. So our nation's poor health is not just a matter of chronic disease 20 or 30 years down the road. We are a less safe country right now because we're an unhealthy country. And again, I think if we can reframe health to fit in with American voters' priorities, we'll get a lot more traction. I'll even take a deeper dive into the opioid epidemic later, but it should not come as a surprise to anyone that this is a priority of the administration and of our office. I'll use my platform to address this epidemic that has impacted so many lives. And as I'll get into later, I also think it gives us a tremendous opportunity. I know that I've worked with the YMCA, for instance, who's on the line quite a bit in Indiana for diabetes prevention. I know that I've worked with other partners on smoking and on alcohol issues and on cardiovascular disease and hypertension and stroke. Well, this opioid epidemic really gives us an opportunity to bring partners together and to lift up issues that will help improve health throughout communities, no matter what your particular area of passion is. I want to talk to you very briefly about the role of the Surgeon General, because a lot of folks don't know who I am, or well, they know of the office, but they don't really know what my job is or what I do. The role of the Surgeon General is to communicate the science around health to the American people. I'm really a translator. A study comes out and says, such and such is bad for you, or such and such is good for you. And it's my job to help Americans understand what that actually means to them and how they can implement it and practice in their day-to-day lives. As Surgeon General of the United States, I'm focused on promoting health, preventing disease, and leading with the science. And in doing so, I can only be successful if I can help other health professionals communicate the science in a way that resonates with the American people. Some of you may have heard me say that advocates for public health can be arrogant. And it's not because I don't love my public health friends. I have a master's in public health and consider myself a public health advocate. But we think the evidence supports our position, and that's all that should matter. But when we're addressing multifactorial health issues like the opioid epidemic, like guns, like universal access to health care, like what our community should look like, we can't operate in silos, and we have to realize that health needs to be a critical part of a multivariate policy equation, but it is only one variable. And again, looking at what voters prioritize, it's often not the most important variable in their equation. Whether we're looking to improve our nation's health outcomes, our economic prosperity, or our national security, we need partnerships and collaboration. And that's what today is all about. That's what the work that you're doing is all about, because we share more in common than there are differences that separate us, and we can only change our collective futures together. As Surgeon General, I'm committed to using my platform to strengthen connections within the public health community and forge new partnerships, including with the business community, with the law enforcement community, with the education and military communities, and very importantly, with the faith-based communities. I'm so glad we have the Center for Neighborhood and Faith-Based Partnerships, because I firmly believe we haven't leveraged the resources and the connections and the assets of our faith-based partners to the degree that we need to or that we could. I want to give you a couple of practical tips for gathering non-traditional partners, because partnership is easy to say, but it's hard to do. Number one, you have to start by thinking to invite them to your table, because no one's going to show up if you don't invite them. But we've got to go beyond that. We can't just invite them to meet with us. We need to go to their table and meet them at their home base. And I don't want to take up too much of your time, but a quick story I tell is about my experience in Scott County, Indiana, when we had to deal with an HIV outbreak related to injection drug use. And I was in Indianapolis, in the big city, 2 hours away from Scott County. If I had said to the local sheriff, hey, why don't you drive up to Indianapolis so I can tell you how to fix your outbreak, chances are he would have never called me back. But the fact that I was willing to drive 2 hours into rural Scott County, Indiana, and sit at his table and ask him how I could serve him, servant leadership, ask him how I could be a part of the solution to his problems instead of putting my problems before him, that made all the difference in the world. Because we've heard this said before, and I'm fond of it, nobody cares what you know until they know that you care. So we've got to show folks that we care about their priorities and not just try to ram our priorities down their throat. As I stated earlier, one of my priorities is health and economic prosperity. And as Surgeon General, I would like to release a Surgeon General's report establishing the link between community health and economic prosperity. The premise of the report being that healthier communities are more prosperous communities. We know that healthier communities are going to have less absenteeism, greater productivity, and ability to recruit a workforce into that community. and overall lower cost. The scope of the report, it would be looking at the entire country, because we know poor health across our country is hampering our wealth. Productivity losses as a result of employees who don't come to work or who work while sick cost U.S. employers $225 billion annually, or over $1,600 per employee per year, according to studies. Let me state that again. It cost employers over $1,600 per employee per year because of poor health. That's something that I think we need to lift up within these communities when we're trying to bring partners together. We need to show them that, hey, we've got something that can help you lower your costs. We want you to do it out of the goodness of your heart, but we also want you to know it's going to help your wallet. Obesity and related illnesses cost the nation over $153 billion per year in lost productivity, another economic indicator. And opioid addiction and overdose cost $20 billion in lost productivity each and every year. If businesses and communities value health, it can increase their bottom line, in addition to making your neighborhood a better place to live. Benefits for businesses include increased employee health, increased production, increased consumer likability, lower absenteeism, lower turnover, which is a huge cost, and lower healthcare costs. Number one cost for most Fortune 500 companies is salary. Number two cost is healthcare. Healthcare is really bringing down the success and profitability of companies. And when you look at Amazon and where they're going to put their headquarters, you better believe that they're looking at the health of communities and determining where they're going to bring in thousands of new jobs. Benefits for communities include increased workforce readiness and increased customer base, which leads to increased tax revenues, increased recruiting, lower healthcare costs for the community, because we know a lot of these costs fall on the local ER, fall on charity care, and end up costing the community its money that could be spent elsewhere, and also decreased crime, particularly when you look at the opioid epidemic. I would rather get someone into treatment and save money in that respect than to have to pay to incarcerate them, pay to repair broken windows from people burglarizing houses, pay for all the ramifications of the opioid epidemic. Now, there are several ways in which businesses and communities can invest in health, and I want to give you one quick example. Belden is in Richmond, Indiana, and it's an example of how private sectors can play a big role in addressing the opioid crisis. Belden is a leading technology company in the Midwest. Their factory is one of the biggest employers in Wayne County, Indiana, Richmond, with over 8,000 employees. Being one of the biggest employers, they've chosen to address the needs of those suffering from drug addiction by providing them with the opportunities to get on the road to recovery. They discovered that employment opportunities were going unfilled at increasing rates due to applicants failing a drug test that is required to meet the needs of the factory. Vacant positions and extending hiring cycles risk impacting their ability to adequately meet their customers' needs. It's hurting their bottom line to have someone fill out an application and come in for a first interview and come in for a second interview and then take a drug test and not be able to pass that drug test. Because of the dramatic rise of drug test failures, they collaborated with local health service and community colleges to develop a pilot project to help their neighbors get on the road to recovery. Under their Pathways to Employment program, and you can look it up online, when potential employees fail a drug test and they're given the drug test up front now instead of at the end, they inform them of the reason their application was rejected and offer them the opportunity to participate in drug counseling. Previously, they'd let them go through the whole process, and if they failed the drug test, they just wouldn't call them back. Not even an acknowledgement, and certainly no referral to treatment, which didn't help the individual or help the company. Now they'll assure participants that stay in the recovery program a job. Belden is working to connect people to care in hopes that they can become employee ready, and they've already found that folks who are participating in the program are some of their best and most loyal employees because they've been given an opportunity, they've been given a chance, they've been given hope. Now, I want to finish by talking a little bit more about opioids. 2.1 million people in the United States struggle with an opioid use disorder, and there's a person dying of an opioid overdose every 12.5 minutes, with more than half of those individuals dying at home. Hopefully you all are aware that about a month ago I released the first Surgeon General's advisory in over 10 years, and it was to raise awareness of naloxone. Because with over half of these individuals dying in a home environment, we know that we can't just rely on calling 911 to dig ourselves out of this hole. It takes about 4 minutes of not breathing before you have irreversible brain injury. And we know that most ambulances, most first responders can't make it to that house in 4 minutes. But I got to tell you, I'm tired of talking to mothers and fathers who tell you the story of their son or their daughter who died just on the other side of a bedroom wall, or just in the garage, or just out in the car, and could have potentially been here today if they'd known about naloxone. Every state, all 50 states, allows access to third-party individuals to pick up naloxone, which means any one of you all listening can access naloxone. And I challenge you, the next time you go to a pharmacy for any reason, ask the pharmacist, can I get naloxone? Because the more we ask about it, the more we lower stigma, the more we raise awareness. I ask you to think if you or anyone who you know or anyone who you might encounter on a day-to-day basis is at risk for an overdose. That includes individuals who are taking high-dose opioids for chronic pain, individuals with substance use disorder currently or who are just out of treatment, and individuals who are misusing opioids. If you know of anyone who may be at risk, then think about carrying naloxone, know how to use it. The training is incredibly easy, and you can save a life. In closing, I want to state that every single one of you on this call is on this call because you're a leader in this community, in your community. That means you have an opportunity and a responsibility to lead by example. It's imperative that we all use our platforms to maximum effect, and that starts with humility and servant leadership. I challenge you to think of at least one new partner who you can invite to your table and to whose table you can go to. And particularly in light of the discussions we're going to have today, think about how you can engage both the business and employer communities and the faith-based communities to come to your table and solve some of these difficult problems. I challenge you to stop the next time you're about to do something that you know is scientifically valid and that you know will improve individual or community health. You know what the science says, but stop for 1 second and have the courage to instead ask that person what their goals and desires are. Show them that you care before you try to show them what you know. Go to the Belden in your community and say, how can I help you increase profitability? How can I help you increase your workforce? How can I help you be a productive participant in this community and contribute to economic prosperity, instead of saying, hey, I want you to care about diabetes, or I want you to care about my particular health issue. And finally, I challenge you to think about how to be a more effective communicator, because we know what to do. I say this and folks chuckle, but it's true if you think about it. Public health hasn't changed in the last 20 years. Don't smoke, move more, eat better. We know what to do. We're just plain lousy at getting people to do it. And that's because we don't ask what's important to them and try to frame what we would like in a way that resonates. My motto is better health through better partnerships, because no matter what area of health or public health you're passionate about, if you commit to forging better partnerships and bringing in new partners and being a better partner, better health is sure to follow. So Heidi, it's been a pleasure. And for all of you on the line, thank you so much for the opportunity. I'm really looking forward to hearing from Charles and from Pastor Travis Lowe. I'm going to be on mute the rest of the time because I'm actually headed to the airport, but I'm going to be listening. And I just encourage you all to be good partners and to really take all that you can from Pastor Lowe and from Charles when they're talking in just a bit. Thank you so much.
Well, thank you, Dr. Adams. We are so grateful for your leadership and for the challenges that you threw out there today. I think part of the job at the Partnership Center is to help strengthen people's response to those challenges, and thank you. Wishing you a safe and uneventful travel as you continue through the stormy East Coast. Thank you so much. Well, I am delighted and privileged.
Absolutely.
Okay, fantastic. I am delighted and privileged to introduce our next presenters for today. I'm going to introduce them both, and then we'll have Chuck Collins start us off. Charles Chuck Collins is the President and Chief Executive Officer of the YMCA of San Francisco. It was founded in 1853, and the YMCA of San Francisco has 2,000 employees and over 2,000 volunteers overseeing its dozens of programs and services for over 183,000 children and adults in 14 branches throughout the Bay Area. They also have 120 additional off-site program locations, which we know are many of their community partners. Chuck brings his broad experience and background to this work of workforce development. He's worked in real estate development, law and government, urban planning and housing, leadership in the arts, as well as his tenure at the YMCA, and they are addressing the issue of unemployment and underemployment with the belief that self-sufficiency is critical to health and well-being. And he will be followed by Pastor Travis Lowe, who was the senior pastor at Crossroads Church in Bluefield, West Virginia, and a frequent blogger. His posts include missional economic development in Appalachia and I've Seen the Future, It Looks Like Appalachia, in which he quotes, "A job is not merely a delivery mechanism for income that can be replaced by an alternative source. It's a fundamental way that people assert their dignity, stake their claim in society, and understand their mutual obligations to one another." With this in mind, Pastor Lowe has led his community to step forward in tangible ways to help his community develop new skills, new partnerships, innovations, and new businesses. We are so grateful to you both for being with us. Chuck, we're going to start with you. Good morning out there in California. Let's make sure you're geared up and ready to go.
Just a second. We're getting this.
Okay. All right.
You didn't go to the drop-down window. The drop-down window was going to give you the clue. Did you send the drop-down window?
Okay.
Will you resend the drop-down menu?
Chuck, this is Ben Odell. I'm helping here with the PowerPoint presentation. Let me go ahead and run your slides for you today. Just let me know when you need to advance your slides.
Okay. Tell me when the screen is on. Okay. So first of all, I want to thank Dr. Adams for his keen insight into this important issue of economic insecurity and how that contributes to our public health crisis. I also want to commend him for his attitude of finding solutions through partnerships and collaborations. And also, one of the most fundamental things for all of us is to find out what is in the minds of those that we are trying to address, not to come with a package of solutions, but to begin the inquiry by developing the relationship and the understanding and the humility that comes with that. I also want to thank Heidi Christensen, and I want to thank all of those at the Department of Health and Human Services and their Partnership Center for bringing us together to talk about this important point. But to Dr. Adams, I also want to just highlight that Master's of Public Health is from the University of California at Berkeley. And as a proud Bear, I'm sure that you have deep California roots, and we hope that you'll come back soon and visit us so that we can help you to spread what you need to say to the American public about the importance of public health.
Absolutely. I'm looking forward to it.
Oh, wonderful. Well, I'm glad you went off of mute, because that's a solid invitation for you to come out here for me to get a chance to see you in Washington. But before I address the role of workforce development in the opioid epidemic and the YMCA's role, I want briefly to mention that Ys across the country, depending on their community and the needs they are facing with this disorder, are working across these spectrums of prevention, control, and reclaiming lives. We are helping to equip kids and young adults to build social and emotional skills to resist risky behaviors, achieve optimal health and well-being, and to help them become career-ready and economically healthy. We are working to help those affected by opioids, the individuals with the disorder, to control their disease. We are supporting the families who are impacted by the effects of the disease, and we are helping to have a greater sense of community healing. We are helping those with the disorder, along with their children and families, to reclaim their hope and health. The next slide, please. The following slide, please. What I wanted to also tell you about is a large holistic vision that we have at the YMCA of San Francisco that we call our 2020 vision. And that is that the healthiest kids in America will live in the San Francisco Bay Area, building the skills and habits to reach their highest potential and in turn to make valuable contributions to society. We have this vision not because we don't think that the notion of the healthiest kids in America is universal, but we're talking about how we have worked in partnership and collaboration in our geography to help to create the conditions for optimal youth development. And one of the most important aspects of this certainly is in chronic disease prevention. We want to make sure, as Dr. Adams was saying, that we get ahead of the storm, that we are not only responding, which we do with compassion, but also that we create conditions in which opioid addiction is less likely to occur. Youth development programs support the type of positive development that research says can prevent drug abuse. Studies have shown that quality programs can have a significant impact on reducing the early use of tobacco, alcohol, and illicit drugs. The Y recognizes that substance misuse within a household is an adverse childhood experience, placing stress on youth and young adults and even resulting in abuse or neglect. Local YMCAs are responding by providing children with safe environments and caring adults, implementing trauma-informed approaches to care, coordinating and collaborating service delivery with community partners, building resilience in youth, developing workforce readiness skills, and so much more. Next slide, please. Youth development programs can help to spot opioid abuse among young and adults and youth and refer youth to treatment. And these programs can help identify youth and adults that are impacted by substance abuse in their homes and in their families. The YMCA as an organization that is working with populations across the lifespan, as kids and young adults, with adults and families, and throughout our communities who have a greater impact on the strength and cohesion of our communities. Nationwide, we serve 22 million people, including 9 million children and youth. But we serve individuals across the lifespan in multiple sectors of our society. At the YMCA of San Francisco, we reach 10,000 young people each and every day in 3 Bay Area counties, Marin, San Francisco, and San Mateo, and over 150,000 youth, adults, seniors, and families each year. As was said by Heidi, we deliver these programs at 120 sites in 14 branches, and we have a massive employment and volunteer corps. Our workforce development efforts in San Francisco are working with a population of youth who are at risk of being a part of or who are already involved in the juvenile justice system and whose parents may be incarcerated and at risk of dropping out of school or turning to opioids or other drugs. Next slide, please. When we think about how we build the skills and capacity to help kids succeed and reach their highest capacity to contribute to society, we focus on strategic outcomes that can influence our child's optimal health and ability to thrive. To this end, we are working to ensure a healthy kid is prepared to succeed in college and career. Our challenges are that the dropout rate in San Francisco is 17%. Almost 1 student in every 5 will not graduate from high school. San Francisco has the highest income inequality of any Bay Area county, with top families earning almost 27% more than low-income families. The lack of coordination among service providers leads to less resource sharing, inaccessibility, primary, secondary, and tertiary interventions. And as Dr. Lowe will talk a little bit later on about how these impacts really get to a spiritual crisis that will not really alone be able to solve what we need to do. For teens and adults alike, we know that gainful employment provides the structure and meaning to life and an alternative to substance abuse. Employment provides a clear pathway to economic independence and ensures personal well-being, and struggling with substance abuse or coming from a family struggling with substance abuse can make employment difficult. The Surgeon General talked about this. So how do we get ahead of this? With the prime working age of adults being between 25 and 44, we know that gainful employment provides structure and meaning to life and an alternative to substance abuse. This is why youth workforce development programs, and for youth we're talking about ages 16 to 24, are crucial. Next slide, please. This is our YMCA of San Francisco approach to delivering solutions to the aforementioned community challenges. Intentional school re-engagement programming in partnership with school district leaders, teachers, parents, and referral agencies. Workforce development services that lead to specialized certifications, soft job skills, career exposure, and corporate and business volunteers for job placements. Association-wide cohort structures that align all of YMCA of San Francisco education and workforce services. And also we share our resources and we provide and establish unified measurement standards. In addition, I'd like to highlight one of our key solutions as being able to provide training and capacity building to our volunteer partners. Volunteers that come from individual groups as well as corporations and faith-based organizations. The goal of our capacity building activities is to help equip our partners in successfully interacting with our young people. As such, we're able to offer things like implicitly biased trainings and cultural awareness activities and restorative problem solving and so much more. Moreover, we leverage our federally funded YMCA of the USA Reach and Rise National Mentoring Program that recruits adult volunteers and trains them to be paraprofessional therapeutic mentors to youth, elementary and middle schoolers who are presenting with academic challenges, anger management issues, emotional challenges, and more. Mentors are likely to work with their mentee once a week for 12 months and are fully supported by a team of clinicians and staff leadership. In total, one of our workforce programs employs a collective impact approach to connect academics, education, and workforce on all levels, including family engagement, youth employment, employment workshops, and career awareness. Next slide, please. I'd now like to transition into describing a cornerstone program of this work, our workforce development programming at the Bayview Hunters Point Y. Nearly 400 unique clients are served, 84% of job readiness and job search clients. Those who are not placed are referred to secondary support services for mental health, for barrier removal, and continuing education. We have a technology springboard platform where 90% of those that were involved received internships and jobs, and the average salary for those placements was $55,000. This is an important matter to really look at how we engage with our local economy. Next slide, please. Drilling farther down, our BAYVIEW workforce programming, our Transition to Independent Living and Life Skills program is addressing some of the most significant needs in the BAYVIEW community. Our economy alone will not solve these problems. We have some of the highest levels of unemployment among our poor people and the lowest levels of employment in our standard population. So trickle down isn't working, and as the Surgeon General says, we have to be smarter about partnerships and collaborations. I'd like to also move to the next slide. We have a Transition to Independent Living and Life Skills program that we call TIL. The TIL program targets ages 16 to 24 and provides vocational training opportunities in the hospitality, technology, and healthcare industries. Our approach uses a three-tiered system of job development, skills and workplace preparation, and job placement. Participants undergo comprehensive assessments and are provided with a continuum of care that works with wraparound services as a model. Next slide, please. Another workforce development program is our Empowerment to Employment, our E2E program. And this is, based on a 2017 study that found that the unemployment rate increases by 1% in a given county. When that happens, the opioid death rate increases by 3.6%, and emergency visits rise by 7%, the direct correlation between unemployment and opioid crisis. The E2E program creates a viable pathway to enduring and sustainable employment for youth ages 16 to 24. And participants complete a comprehensive program to prepare them with getting certifications and partnerships with businesses and internships, mentorships, and being job ready. Next slide, please. When we look at how this happens in our own community, it's very important to get a clear view, as the Surgeon General said, through data and research, hosting focus groups and participating with local leadership councils to understand the local context. Identify and bridge connections with potential partners in workforce development using government agencies, local businesses, faith-based organizations, and provide training capacity building for your volunteers to partner so that they can fully understand the needs of our targeted population and they are equipped to help youth succeed. So finally, what I'd like to say is that, this is very much, as the Surgeon General has said, that we have to have partnerships and collaborations. We must listen to our community, and we must work together in order to weed out what we need to do to separate ourselves from the onslaught of doing your own thing, and to really fight back carefully to work in partnership and collaboration to address this crisis. Thank you.
Well, goodness, thank you so much, Chuck. You caught me. You just stopped right there. You caught me that I was so engaged in what you were saying. Thank you so much. I know that there's so much more that you didn't say today, and I do suggest, and we'll send out links to information that connects people to the website and these programs in the follow-up letter. But I do commend it to folks to take the time to troll through your website and some of the programs that you talked about and think about how that they may be adapted or translated in your own community. So thank you. Pastor Lowe, hopefully you've not gotten blown away in this West Virginia storm. We are eager to hear from you and what you're doing, what's happening in Bluefield, West Virginia, to help people get back to work and on their feet and embrace their future.
Yes. Wow, this has been incredible information. I've been blown away with a lot of the even just the statistics that he shared on the opioid crisis, a lot of that I'd never heard. I've been asked to share just a little bit of what we've been doing here, just sort of as a personal story of what can be accomplished through partnerships in communities. About 5 years ago, I became the pastor at Crossroads Church, and most of my employment history was in the banking or finance sector. And then the door opened to pastor, and it was a completely different experience. It was a large learning curve for me, and I struggled a little bit in the onset with just knowing how to relate to people as a pastor. It was much easier for me to talk to a business owner about ROI than it was to talk to someone about possibly marital issues or things that were going on in their life. And I came to find the best friends, the people that I connected to the best in my church was actually business owners. And about 5 years ago, the economy was really rough in our area. It still is, but it has improved some. But a lot of the business owners were second or third generation business owners who were scared that they would be closing down shop on their watch. And there was a lot of fear that was involved with that. And so we began to sit down, just a couple of us, and it started out really small, 2 or 3 of us sitting down, just sort of brainstorming about work issues. How could we expand clientele? How could we open up more business to the area? How could we look at different markets? And I look back on all that's been accomplished now, and it's wild to think that it just starts with friends sitting down around a table. But I'm reminded of one of my favorite quotes. It's from Margaret Mead. It says, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." And as we sit down, that's why I think it's so important that you're highlighting partnerships, because we just sat around the table. We didn't know what was going to come from it. We had no agenda other than trying to speak hope to our community. And as we began to do it, we read a book called Why the Garden Club Couldn't Save Youngstown. It's a Harvard Business Review book, and it was an incredible book looking at 2 Rust Belt cities, and one that came through the Industrial Revolution and thrived, and one that pretty much died away. And the question they were addressing was, why did it happen this way? What does it take for a community to survive tough economic times? And they identified 3 priorities. One was to help businesses kind of recreate, see new things that they could do. The second one was to encourage entrepreneurship. And the third was to encourage business owners to invest in their communities. And we kind of took that on full board, that we wanted to do all 3 of those things in their community. So we worked with some of the local businesses on ideas to help them retool. We're in the process of creating a Fab Lab, which is a program through MIT that brings the means of invention to your community. We really picked up on the entrepreneurship goal, and we have 2 colleges in our town, and many of the students that I spoke to only saw the negatives of our community, and so I wanted to highlight some of the positives. And the first thing that we did was just host a entrepreneurship panel at one of the colleges. And we had several local entrepreneurs that had started their own business tell their story of flourishing in our community and how they were providing jobs and providing meaningful employment for people here, and how it was providing a good life for them and their family. And it was an incredible time for a lot of the young people in our community just to hear these positive stories. I didn't realize how much that was missing, but I had a student come up to me who was a 4th-year student and said that it was the first positive story that she had heard of our community in 4 years. And so we decided that we wanted to really build off of that. So we worked with a lot of those entrepreneurs and began hosting a yearly event that we call Launch Appalachia, which just encourages people with ideas for entrepreneurship to pitch their idea in a Shark Tank style format. And we pick the top ideas and we resource them. We have money that we give to them to help them start their business. We've provided office or retail space for them. We've provided mentors and lots of different connections, and we've seen businesses start up through that. One of the projects that I'm currently pushing for is for us to offer a Launch Appalachia just in our recovery communities. And in my mind, it's the idea of addict to entrepreneur. We see so many of the stories of how drug addiction can ruin lives. And I want to show the stories of people who have overcome opioid epidemic, the drug addiction that they're facing, but how they've overcome that and turned around and offer something great to the community. And we actually have people in our community that have done just that, and they're successful entrepreneurs after they went through such a tough struggle. And so we're going to be hosting one of those events coming up. We have formed a nonprofit called EDGE, which stands for Economic Development Greater East, which focuses just on land-based entrepreneurship, which we have so much opportunity for around here. There's so much available land, and land is fairly cheap, that we're teaching people how to make maple syrup. We're teaching people how to harvest honey, do wild harvest of ginseng and different roots that are in the area, teaching people how they could have a greenhouse and raise food and sell the food for income. We've actually piloted a program in Southside Elementary School here that is teaching students in the school with greenhouse on site how to grow vegetables and different products right at the school. And then we're going to teach them how to start their own business with that and sell the product, learn how to balance their checkbook, learn how to figure out their profit, learn how to manage expenses. And we're actually offering that program not just to students at Southside, but also to their parents. So that we hope that it could become something where maybe if they have a couple acres around their house, that students and parents working together could start small businesses that would provide for their families. It's really been an incredible thing. And just through all of this, the partnerships that have been forming is the biggest thing that I would highlight. We've started EDGE. We have Launch Appalachia. My group is called Rebuild, Revive, Thrive. We work with a local group from one of the colleges called CART, which is helping some of the entrepreneurs with research and development. They have an idea for a product. We're working to get that product to market. When I first began this trek as a pastor, I kind of felt alone because I didn't see many pastors maybe thinking in terms of economics, thinking in terms of what role the economy could play. And it wasn't just pastors. A lot of the business owners in my church could not see how what they did played a role in what we believe was the purpose of our faith community. And so I was so happy to find a group called Made to Flourish, which I would encourage all of you to check out. It's a group of pastors nationwide, and they do a lot to help resource pastors to think in economic terms. And it has helped me so much to be able to share with the business owners that what they do every day is providing hope to our community. They're providing jobs, which we know makes marriages more stable, which makes home situations better for the children, which gives children a more stable place to grow up, which makes them less likely to get on drugs and more likely to succeed. So we've been able to work with our different partners and see so much happen in our community. And what Ben and Heidi had asked me to kind of highlight was, how could you do this? If you're a local faith leader and you want to know how you could take some of these steps, this is what I have. It's pretty simple. I would encourage you to start visiting the people at your church at work, or the people that come into your different organizations. Go and meet them at their work. That's a picture on the screen of me. I actually got to go down in one of the local mines here in the area. It was an incredible opportunity, and it's amazing what you would learn if you just show up and ask simple questions. I've taught many pastors to just ask the question, how's your business going? Business owners love to talk about that, and then say, what keeps you up at night? And that leads you straight into ministry. You're able to begin to think about the issues that are on their heart and begin to come up with ways that you can meet those needs. I say seek to understand, try to be a neutral convener. Many of us in the faith community are surrounded by just tons of resources, people from every socioeconomic level, people from lots of different backgrounds that maybe wouldn't cross paths at any other time. And when they come to our service or they come to our place of business, they are surrounded by different people. How could we set these people up to be employment agencies? You wouldn't believe the number of people that call me saying, I'm looking to hire or I'm looking for a job and I've got to be this connection. But just begin to invite people to lunch. Begin to invite people that maybe don't cross each other's paths and get them both talking at the table, and you'd be blown away at the things that come up. Just through our meetings with business owners last year, we had over $1 million of local business deals done at our meetings. And that translates into more jobs in our community, which translates into more hope. And I pray that it translates into less depths of despair. So I encourage everyone to forge partnerships. Get outside of the normal routine. I think maybe for us pastors, seminary has taught us to sit in our office and wait for people to come to us. And I just challenge pastors across the country to get out of your office and go find people where they are and engage in your community. And you'll be blown away at the difference that you can make. Again, Heidi, thank you so much for this opportunity, and I'll turn it back over to you.
Well, goodness gracious. There are so many juicy nuggets in there of wisdom and practical suggestions. But, Pastor, it is just such a I just envision that you outlined is to get out of whatever role we're in, whether we're in a church or a community organization or a public health office, is to get out and see where people are, ask them how they're doing and what keeps them up at night, and build from there, and then join them with others in the community who want to take on the bits and pieces that in the end contribute to human flourishing. And that's really the business we're all in, isn't it? So thank you for that. I think we're a little short on time. We have lots of questions. Friends, we will, because we're going a little long today, we'll try to divvy up these questions and make sure that we get back to people as we are able, along with our presenters. So stay tuned for perhaps a follow-up letter from us. Friends, we will also be sending you a recording of today's webinar along with many of the resources that were referenced. I'm glad, Pastor, that you brought up Made to Flourish. It's been extremely informative for our office and how to lean into the idea of economic well-being and health and how that relates to actual practical work on the ground. So we'll get that to you all. So everyone keep your eye out for that follow-up email. I want to personally thank our speakers today, American's Doctor, Surgeon General, Vice Admiral Jerome Adams, Chuck Collins and his team out in YMCA in San Francisco, and Travis Lowe, pastor and entrepreneurial thinker from Blue Hills, West Virginia. Thank you for taking the time today to share your stories, your insights, your experience, make your suggestions, and also for the challenges that were sent out into our communities today. We want to thank you and for everything that you're doing to bring hope and healing to our communities. Friends out there, thank you most of all, especially to each and every one of you who got on the webinar today for joining us. Thank you. Thank you for your leadership in communities. Please stay in touch. If you're not on your mailing list or have a question that you'd like to send as a follow-up, we are at partnerships@hhs.gov. And with that, thank you again to our presenters. Have a great afternoon, and let's keep up the good work.